all the dignitaries of PMU, Honorable Vice Chancellor, Dean PMU, Dr. K.C. Yadavji, Principal PMU, and all the professors and associate professors and lectures of the PMU, and all the students. Myself, Manoj Verma. I'm working as a Chief Nursing Superintendent in Railway Hospital, New Delhi. My topic of this workshop is nurse's perspective in chemotherapy and occupational hazard. One by one, as priority, we will see. Firstly, I will start for a few minutes cancer case. Anyone can tell us that what's the date of cancer day? Anyone can raise their hands?
Yes, sir.
Okay, please tell. What's the date of cancer day?
19th
4th
August.
February. Very good, very good, very good.
Sorry, sir.
Okay. तो ये हमारी तरफ से आपके लिए छोटी सी गिफ्ट.
Thank you.
Next question. Nargis Dutt. I think everybody definitely this familiar from this name. From which cancer she died? Very good, very good, very good. Pancreatic cancer. And next question. Irfan Khan. Anyone can tell to me that which type of cancer he suffered? Neuroblastic tumor. Very good, very good, very good. Now after the quiz, we will, here we go from next topic. Firstly, what is cancer? Cancer is the uncontrolled growth of the body cells that crosses their boundaries and invade to other organs and other parts of the body. That is cancer. Next, some of the specific informations regarding to cancer. Most common cancer is breast, then lung, then colon, then rectum, then prostate. Do you know 1/3 death from cancer are due to tobacco use? And worldwide, if you will see, 19.3 million new cases are suffering from cancer, and 10 million people died from cancer in 2020. And by 2014, number of new cases expected to rise till 30 million. Unexpected rise. So we have to aware from the cancer. Next, chemotherapy. Chemotherapy, what is? It is the use of cytotoxic drug that kill or destroy the cancer cells without affecting the host. हम कह सकते हैं कि ये वो वीपन है जो कि कैंसर जैसे साइलेंट किलर्स, टेररिस्टिक पॉइंट्स को एज ए सोल्जर डिस्ट्रॉय करते हैं. नेक्स्ट, रूट्स ऑफ द कीमोथेरेपी. Following routes are the chemotherapy. First, oral route. In oral route, oral tablets or capsules through the respirators. These chemotherapies are given. Next, intravenously. Chemotherapy also infused to the patients. In IV route, port a cath. This is the types of routes of chemotherapy given through in this. This is implant just below the and between the clavicle bone and directly attached to the heart. Some of the parts of chemopod, maximum time of multiple times through the syringe in pot can insert the chemotherapy drug. It's a non-invasive after the infusion of the chemotherapy. Next, subcutaneous chemotherapy can be given intraventricular or intrathecal. Through the lumbar puncture, chemotherapy is given intraarterial. Into the arteries, chemotherapy drugs given intraperitoneal through the peritoneal cavity when the chemotoxic and cytotoxic drugs are given. That will include intraperitoneal, intrapleural. When in the pleural cavity, the cytotoxic drugs are given into this, and intramuscular. Through the terms, we can easily understand that it is given intramuscularly Intravesical, that means in the vesical cavities, just like uterus or bladder, cytotoxic drugs are administered. These are some of pics that clears that how the cytotoxic drugs are given into the body. These are the first pics: intravenously, oral cytotoxic drugs, intraventricular, intravenous. Next, we will see the chemo treatment modalities. First, adjuvant chemotherapy. These are the chemotherapy in which cytotoxic drugs given to destroy the cancer cells in additionally in standard form. New adjuvant chemotherapy. Next, this is include adjuvant and till present perspectives. New standard of the chemotherapy are given. Multimodality. In multimodality chemotherapy treatment, different types of treatments are in combined form. And next, concurrent chemoradiation. In the chemotherapy, some of the cytotoxic drugs that impulse the radioactive substances that destroy the cancer cells. Hormone therapy. In this hormone therapy, in the form of hormones, some of the cytotoxic drugs are given to the cancer patients. Immunotherapy or biochemotherapy. In this, some of the modifiers, BRM, bio research modifiers, are given in form of chemotherapy and targeted agent chemotherapy last. In this, all the uncontrolled growth part, only selected cancer cells are destroyed. That is targeted agent chemotherapy. Next, we will see the pre-operative management of the chemotherapy. In this, use strict aseptic techniques for to reduction the chances of infection of the patients. Before it, assessment of the nutritional level of the patients so that they can tolerate the side effects and effects of chemotherapy he or she can tolerate. Explain about the procedure so that the patient anxiety and their confusions can be removed regarding to the chemotherapy treatment. And during the preparation infusion of the chemotherapy, patient blood profile just like hemogram, LFT, KFT, serum electrolytes, samples collected and sent to the labs. And before administration of the chemotherapy, we should collect the reports and send to the physician. Next, IV cannulation. Before administration of the chemotherapy, IV cannula should be put. Generally, pink cannula we should insert so that the clear pathway can be established to the patients. Next, vital signs should be checked. In this, temperature, pulse, respiration, blood pressure, saturation, SpO2 we should check. Ready safety for biocabinets. Generally, in our railway, second type of biosafety cabinet are used for the preparation of the chemo drugs. Spill kit. In the spill kit, face mask, gloves, gowns, all the sheets, 2 yellow bags should be prepared. Next, we will see this is the pick side toxic, handle with care because these are hazardous for the body. Next, for the administration of the chemotherapy, we should take a short admission of the patients. For the in short admission, treatment entry in treatment book should be ready. In there, at last of the page, some of the line in consent form. In this, patient's relative sign should be confirmed so that during the procedures, so many emergency conditions can create, hazardous condition can create, so that in legal bona fide matter, we will save in this type of matter. If the chemotherapy is given to the cardiac patients, then ECG should be done, and resourcefulness through the procedures. This should not happening should not be there. That at that time we are running here and there for the small things, syringes, procedure, articles. What are the health protocols required? Those things should we keep nearby us. Demand analgesia for the patient. If the patient is suffering from pain, then as per the physician's order, we can analgesic put to the patients so that during the chemotherapy, the patient can be free from pain. TPN assessment. If required, the total parental nutrition can be put to the patient's intralipid and hormone are also part of the nutrition which is given to the patient if required. Credentialing. Validate the doses. Doses, route, expiry, amount should be assessed before the administration of the chemotherapy. Remove culprit if any patients have anxiety level, then we should remove their conflict, any deviation in mind. Documentation should be properly. Next, nursing management during the chemotherapy. Through the aseptic measures, hand washing should be done. Safety from inhalation of aerosol. Generally, we've seen that during the preparation of the chemotherapy, generally it is done in the bioseptic cabinets. But due to the leaking of the chemo drugs, what was happened that aerosol, all the cytotoxic drugs, when it comes in liquid form, then aerosol they develop. That's why the aerosol through the inhalation, staff, medical team can be affected. So that we should take precaution from the aerosol. Provide comfortable position to the patient. Explain about the procedure. IV medication infusion of diluent. Some of the diluent which is as per doctor order and physical condition of the patient in D5%, in NS, in RL and DNS. Those cytotoxic drugs are diluted before the infusion of the patient as per doctor's order. Monitoring through cardiac monitor. AST preparation of the chemo drugs. Some of the generally we should follow this. After sensitivity test, medications can be create anaphylactic reaction, so that before infuse for the 15 minutes some of the amount infuse and see the allergic reactions. Check drug allergies. Health protocol should be follow. Gown, mask, gloves, face shield, Google, PPE kit should be wear. Drug should be prepared in safety cabinet. We have already discussed. Use dry spill kit near spill area. Spill area जो spill kit के near रहता है, that should be dry, so that the aerosol cannot be formed. Use drugs on vials, the absorbed pad away from the body, so that the aerosol can be absorbed in these pads. Cover tip of needle with sterile gauze. When the inserting the IV line, IV cannulation, then through the gauze it should be covered so that the chemotoxic drugs cannot be formed in aerosol. Use Leo lock fitting syringes. Generally, we have seen that in vial when they introduce and dilute the cytotoxic drugs, pressure can be developed more. That's why these Leo syringes, these are fitted needle to the syringe through the, we can say there are two lining just like bangle. This can be rotated and it is fixed. If any pressure will develop, then it will not be expulsed. Otherwise, the cytotoxic drugs can be flourished. That can be hazardous for the medical team. Label our chemotherapy drugs and administer as doctor order. Change gloves in every 60 minutes, because these are the latex and the chemical reactions with the chemocytotoxic drugs can be hazardous for the patients. Take care for infection and in bleeding and skin problems. Already those patients, those already have a chemotherapy, then there are chances the bleeding, we can say rectal bleeding and all the wounds bleeding. So that type we should observe. And before this we can TLC total leukocyte count, generally it is a 5 to 10,000. That should be major report we should collect before it, and platelet should be monitored so that the in any bleeding situations through the anticoagulant drugs we can control these situations. Biomedical waste management. We should very attention should be given on this in this type of biomedical waste management. When the needles वगैरह we will discard it out in the single bidirection lid of container, and in gauze, wet gauze we should put in yellow bags, and in IV line plastics that should be put into red bags, and all the things we should be biomedical waste management should be attention should be given. Need to practice self-care. These are coming after chemotherapy. If have central venous catheter, then dressing chant and flushing also. Central venous catheter is a procedure which is performed in OT, minor OT. So during this time, to reduce the infection, strict resective techniques we should follow, and dressing should be changed and flushing so that the blood can be go into the body. All clear liquid diet should be advised to the patients. Don't recap needle, keep it into this. Just I have already discussed that in a blue container. This is a single lid unidirectional container. Should put all the needles. Do not recap. उन्हें वापस से recap नहीं करना है. Direct put into this. Next, the other care, home care. After the chemotherapy of the patients, home care should be given. In the home care, generally all the experts seem we should train their relative or attendants so that the some of the first aid type of care can be given by the patient's relative and to the patient's hospice care, palliative care. To decrease the reduction of the pain of the patients, some of the experts and some of our nurses can be given the care in the home with the patient. Psychological supports to the their doubt should be cleared and mentally should be prepared to the patient. Crisis intervention, some of the hazardous situation can be created that should be clarified by the psychologically explanation. Coping mechanism to different types of some of the side effects can be happen, vomiting, some of the skin lesions, extravasation of the vessels. So we should how to adjust and how to handle these situations. We should clarify with the patients. Stress management, patients tensions, anxiety. We should clarify. And this topic stress management. I think not. I think I'm confirmed that Dr. Priyadarshini ma'am will see in luxury way, we can say. Spiritual care, spiritual care regarding to the God, we should given to the patients so that patient can they develop their confidence. Bereavement support, generally it is seen that some of the close person is died of the chemotherapy patients, then it is so difficult to handle that type emotionality, so that this care, bereavement support, sympathetically, empathetically, we should support at that time at home. Application of linoleum cream over skin. Due to the protection of the dry skin and irritable skin, we should, this ointment should be applied. Then rehabilitation care. It is seen that chemotherapy patients, after completion of their treatment, they are in minute amount, they are unsuffered. So rehabilitation care, vocational training can be given to these patients. Diversional care, their mind totally concentrated on that cancer is me. That time it is so difficult for us and for the patient also. So that mind should be diverted to the do busy of these type of patients in any job and any extracurricular activities. Music therapy, slow music during, prior, and after chemotherapy. These are very benefited for the patients. Then inventory register should be maintained. Occupational hazard, next topic. In this, generally we will see in the regarding to the hospital accidents, fire accidents, radiation exposure, exposure to noxious chemicals. They are suffered drug addiction, psychic problems, assault. So we should remove. How to prevent occupational hazards, needle-stick injury, respiratory infection, stress over work, musculoskeletal pain, environment monitoring, all the things, community disease control. We should follow these measures. Health education given to the patients, routine medical checkup, all the head to foot examination related to the chemotherapy, what are the side effects, skin lesion, extravasation, we should check the stress reduction through slow music. Yeah, thanking you. And before the slow music, stress reduction through slow music, it's so very effective for the chemo patients because it will feel free of these type of effective patients and their treatment also affected. So to reduce the stress of these patients through the slow music, we should advise to them. Thank you.